What's going on, everyone? Welcome to the Saturday edition of the Daily Pandemic Update for Saturday, May 20th, 2023. Hopefully everyone is staying safe and healthy, and if you had to take a COVID test in the last 24 hours, hopefully you tested negative. This is the first of two videos that we will be doing today. The first one being Pandemic Update. The second one that we're going to do this afternoon is going to be on how COVID can impact someone severely at any age. I have had so many troll comments and regular comments on Twitter saying, "Oh, I'm not going to wear a mask just to protect grandma," or, "Oh, young people don't get fined. Yawn, it's no big deal. It's just a flu, this or that." No, it's not. So we're going to have a piece that proves that, no, it's hitting everyone hard later on today. So subscribe to the channel if you're interested in seeing that later on. Alrighty, India recorded another 782 cases in the last 24 hours, and they also added another 6 deaths. Moving on to our next story. New York City, since the pandemic has started, has lost 5.3% of its population, nearly 500,000 people since COVID. Most are heading south. And that's a lot of people. 500,000 people. That's 500,000 people. That is a huge drop in population. Alright, moving on to this. We covered this already. I want to cover it again. Vitamin D deficiency linked to increased risk of developing long COVID. Why am I showing this to you again? Because we didn't cover it correctly the first time. What I would like to say is, when you go to the doctors, you usually get a blood test, either before or afterwards. They want you to get a blood test. When you get your blood test, I think it's very important that you go over all of the levels that are being shown on the test results. Because you know what? We are learning more and more about this coronavirus, that it can impact anything, such as vitamin D. Go over all of your levels. Make sure you're up to par. I mean, even if you haven't had COVID yet, maybe you had COVID yet. See what is already, low prior to COVID, or if you had COVID, see what is different in compared to the previous blood test before getting COVID. Just keep an eye on these things, because anything can change with this virus the more we learn about it. Alright, moving on to our next story. And this is just ridiculous. I'm just only even going to read the headline on this. COVID emergency orders are among the greatest intrusions on civil liberties, Justice Gorsuch says. No, the virus itself is what is an intrusion on our liberty. Because of the virus, we can't stay safe. Because of government just taking away all the things that would help keep us safe, that's an intrusion on our civil liberty to stay safe. And that's all I'm going to say about that. Iowa COVID hospitalizations have reached a new low. Wait a second. Did I just say Iowa? Yes, you heard me correctly. Iowa, the state that was supposed to have stopped tracking their data, counting, reporting their data, whatever. They were supposed to have no more data. Well, apparently, they still have data, and they're just not sharing it with the public. Is this data accurate? Who knows? Because, as you know, people are not being tested for COVID going into the hospital in most cases anymore. So, here you go. I was reporting a new hospitalization low. If you want to believe it or not, that is totally up to you. I'm not buying. Northeast Ohio hospitals make masking optional as federal COVID health emergency ends. It's just a sign of the times. Masking should be staying in hospitals. People go to hospitals when they're sick. I mean, okay, some will make the argument, well, we didn't have masking before the coronavirus. Okay, but were you getting sick when you went to the hospital to visit someone as a patient, or you were there for some other reason? I mean, it did happen. It happened before the coronavirus. And now we have a much more transmissible virus, and it's even less safe. What's the big deal? It's something that's so simple, and you can go visit someone and come out of the hospital, and guess what? You won't have COVID, or you won't have flu, or something else. You can go get that knee or hip replacement, and guess what? Because you're masking, you won't catch something else while in the hospital, hopefully. I mean, hopefully they're still wiping the surfaces down for those type infections, but it's just totally ridiculous. This is a really sad story, and this is something you're going to see featured in our opinion piece later on today. I thought my 19-year-old daughter had long COVID. It turned out to be dementia. at 19 years old. And we're not going to go too much into this. Matter of fact, we're going to save this for later today. We'll read more about it. If you want to read it yourself, it's been tweeted out. I retweeted it from someone earlier. 19 years old and getting dementia. That's utterly ridiculous, and clearly that is not normal at all. Moving on to this. Study finds significant amount of clotting in the arteries of patients with STEMI, S-T-E-M-I, and COVID-19. Yes, this is a real issue. We have seen studies on this before. Clots are happening. Every time we see something about clots, I always refer back to, remember what happened with Al Rooker? He thought he was fine post-COVID. Then he had the blood clot issue. All right, moving on, switching gears a little bit. This is in Brazil now. This is H5N1. Brazil is investigating 2 new suspected cases of H5N1. So this is breaking news that just happened just a couple hours before me doing this video. They are investigating 2 cases, and we have more H5N1 news as of, this is as of last night. A striped skunk and 5 red foxes tested positive for H5N1 bird flu as mammals continue to be infected in the U.S. So this actually happened yesterday. We just didn't get to add it to the video because there was so much other news yesterday. Moving on to this. Maricopa County confirms first case of Mpox since January. You know, monkeypox. I'm always going to say monkeypox because that's what it's called. Mpox to me is just a lazy way of abbreviating monkeypox. And for those who don't know, this is in Arizona. So this is adding to the growing list of states that are reporting monkeypox cases. And I have not added this to the website. I will add this to the website just a little bit later. I added a whole bunch of other stuff that we have reported on yesterday and the day before to the website. I'm going to be adding more stuff today. I'll probably be adding some more studies. There's a lot of studies that I have not gotten to add that have come out. Some that we didn't even get to on the video here because just simply I can only report so much in one pandemic update. It's crazy how much we keep finding out about this virus that harms you. But yet, here we are. I mean, masks are being taken away. Everything's being taken away. Everyone thinks it's fine and over with when it's not. All right, Walgreens will update again on Monday. We actually have nothing in pandemic history for today. We'll have our weekly wastewater update video tomorrow. So if you're looking forward to that, hit the subscribe button down below. But let's just do something briefly on wastewater. Number of new sites. There's 144. Number of sites with 0 to 19% of COVID being found in the samples, 539. 20 to 39% is at 424 sites. 40 to 59% of COVID being found in the samples is 128. 60 to 79% is at 22. And just one site is at 80 to 100%, and that is down in South Carolina. We'll take a look at all this tomorrow in our weekly wastewater update, which will come out tomorrow morning. All right, moving on to the latest variants. We did not get the variant update this week, but for those who are new to the channel that don't know about the variant proportions in the United States, XBB.1.5 is in the lead at 64%, XBB.1.16, 14.3%, XBB.1.91, 9.2%, XBB.1.92, 4%. Then comes that XBB.2.3 at 3.5%, XBB.1.51 is at 2.4%, and FD.2 is at 1.8%. Next update on this will be this upcoming Friday. All right, New Jersey. We did get an update on hospitalizations. I don't know what their deal is. They said they're only going to be putting a summary on Mondays, but yet I am seeing the data updating here. This updated yesterday, 519. Hospitalizations, 156. Ventilators are at 10. It does not look like cases updated. Let's see here. Well, I don't think they updated. 115 new cases, 125 probable cases. I wish they would put a date under this when they actually updated that. I do know deaths did update, because remember, there were more than 2 deaths yesterday. I think there were 4. So today, just 2 lab confirmed deaths. And let's see, did we get Philadelphia to update yet with the EMS numbers? Yes, they did. Finally, it just came in. And there were 698 reported EMS incidents in Philadelphia County in the last 24 hours. And that is being retweeted out for you to see. Moving on to New York State, we will not get a New York State update today or tomorrow. They're not supposed to update on the weekends. In fact, by the end of the day on Saturdays, as of lately, the website just breaks altogether and goes wonky. So moving on from this, yesterday they did have 477 cases, 2.5% positivity, which was higher than 2.1%. We're going to be watching closely if this increases next week. Now remember, this does not include reinfections or reinfection. It does not include reinfections at all. And moving on to hospitalizations. Hospitalizations in New York State are at 547. 63 people are in the ICU. Texas will update again next Wednesday. The current week they reported a even 4,500 cases. Odd how it's exactly 4,500. Strange, isn't it? All right, taking a look at this, I wanted to take a look at some of the international variant proportions, and I actually do have a graphic here. Here we go, this one's better. And you can see here, XBB.1.5 is still the dominant strain in the majority of countries. Then we take a look here at XBB.1.16. And a reminder, this is from May 8th. We did not get an international variant proportion update this week. The country with the most is India right now with XBB.1.16. And Thailand's up to 31%. Singapore's up to 32%. And you see some other countries are over 10% as well. Let's take a look at some cases around the world. South Korea, the cases are up 12%. Deaths are now up 1%. Australia, cases are up 17%. We expect that in Australia. They are starting to head into the winter months, and eventually they will as well see a XBB.1.16 variant wave. Let's go back to this graphic real quickly. Do we have Australia on here? No, we do not. I was hoping I could show you Australia's variant proportion, but it's not listed on there, and I think I selected it, and it wasn't coming up for some reason. Brazil, 25% decrease in cases, 41% decrease in deaths. France is really dropping now, 38% decrease in cases, 48% decrease in deaths. Malaysia, 13% increase in cases, 125% increase in deaths, but remember, they had 18 versus 8, so it's not like we're talking a huge number, but still it is a rising number. Thailand, 39% increase in cases, 120% increase in deaths. Remember, they do have that new FU.1 variant. No, I'm not saying the curse word. That's what it's named. It's FU.1. And then you come down here, Israel. Cases continue to rapidly rise. 182% increase. Qatar, 16% increase in cases. Costa Rica, 4% increase in cases. Colombia, 7% increase in cases. A note about the international data, it will be less reliable as we head into tomorrow. A lot of countries do not update over the weekend. Some do, some don't. So this data will be less reliable tomorrow. You'll see me do the percents tomorrow, but just be mindful they could be inaccurate as reporting is less frequent over the weekend. Alrighty folks, that does for today's pandemic update. If you like this video, give it a thumbs up. If you want to see more content like this, hit the subscribe button down below, and I will see you again later today for our weekly opinion piece. But until I see you again next time, you have to test negative and stay safe, everyone. Thanks for watching.